Hi, so welcome to our second module, which will talk on mastering core writing and language skills. Majorly, we will be covering 3 topics in this module. First one will talk on the tips for structuring your content in a clearer and concise manner. Second topic will be touching on the grammatical corrections. And the third topic will be talking on medical terminology. And all across, we will be covering how AI is changing the scenario. So let's start with the first topic, which is on principles of clear and effective scientific writing. So the first principle says, according to the new recommendations, don't go with the passive voice usage. Instead of saying the drug was given by the nurse, simply say the nurse gave the drug or the nurse administered the drug. Societies such as AMA or EMA also recommend the same thing. So even in writing original research papers under the section on methods and results, go ahead with writing we collected blood samples from the patients instead of saying blood samples were collected from the patients. Reason being very simple. Active voice most of the times is more direct, more concise, and conveys the meaning in a clearer way. Principle 2, cut the clutter, say and write in a concise manner. So really, there is no need to use 10 words when 5 are enough. And please refrain yourself from using phrases such as due to the fact that. Instead of writing these long phrases, stick to terms as however, because, so, henceforth. Skip writing terms as it has been shown that. In fact, this phrase can be completely done away, right? So we can simply, instead of writing it has been shown that this drug has a positive outcome, we can simply write this drug has shown positive results, right? Principle 3 about using strong and clear action words, which are the verbs. So don't let your verbs be vague. Instead of writing treatment had an effect on the tumor, had an effect, positive or negative, what type of effect? So be precise, write the treatment shrank the tumor or the treatment inhibited tumor growth. Next principle, do not use complex sentences. Complex, we really need not to show off our language skills. Keep your sentences short and concise. They should be conveying the meaning they are meant to. Likewise, paragraphs should be short, written in simple language, and the first sentence of the paragraph should set the stage for the rest of it. Next principle, be now what exactly do we mean by parallel structure? Just ensure a uniformity in the usage of grammar. So for example, when we state learning objectives of a particular CME module, instead of going haphazard and writing to assess efficacy for one LO and evaluating safety for the other, just stick to a pattern, right? To assess efficacy, to evaluate safety, to measure the drug's impact on QOL. So let's try doing this. A reduction in the severity of the symptoms was observed by the investigators in the subjects who were administered the active drug. Can we simply rewrite it as maybe the investigators observed a reduction in the severity of the symptoms, right? Go ahead with active voice. Keep your sentences short and simple. So now, as we also discussed in the first module, we cannot not talk on AI. Okay, so and in fact, when it comes to make your document hygienic from the grammar and language perspective, AI is really doing a good job. So, as a writing coach, AI is too good. It does help in giving a clarity to your write up. Most of the times, it uh, it converts the voice of the paragraph accurately to active. It will break complex statements and give you shorter and simpler alternatives to them. However, there are two points wherein we need to be vigilant while using AI. First thing, do not go ahead with fancy phrases or terms which it gives you, right? Stick to the simpler terms. So instead of ameliorate, simply go ahead with improve. Because what you are writing in the document should be understood by maximum people. Likewise, AI cannot understand the subtle differences in almost looking synonyms. So, for example, AI indicate, demonstrate, suggest would more or less carry the same meaning. So, herein, human intervention is must. Now, coming to the next topic of the session, which is on essential grammar and punctuation. With AI in place, if I go conventionally and talk on the usage of comma, exclamation mark, colon, semicolon, it won't be just, right? So let us accept that AI tools are excellent first pass proofreaders, especially when it comes to correcting typos, spelling mistakes, and simple grammatical errors. So your job has become far easier and more accurate when it comes to improving the grammar of your write-up. However, as we discussed earlier also, there are instances wherein AI can do blunders. So for example, small vowel obstruction, same phrase with and without a hyphen. The meaning for AI, the phrases are same. However, meaning-wise, they are very different. Whereas without hyphen, a small vowel obstruction would mean little less severity of the intestinal obstruction. Whereas with a hyphen, it would mean obstruction of the small intestine. So herein, human intervention is must. Another challenge with AI, AI would understand AMA manual, AMA style guide, but your in-house style guide, you will have to ensure that it has been taken care of in a particular document. Now, coming to the last topic of the session, which is on medical terminology, demystifying medical terminology. See, medical terminology really looks terrifying, but it is not that much, especially when we have dictionaries, online dictionaries, and AI, it is far more simpler now. So if you look at if you really want to enhance your medical terminology knowledge, then I would say more or less all the medical terms have three root words. One is the root, and then either it is prefixed or it is suffixed. So you can do that to know more about the medical terms. However, it is really not needed. AI and online statements dictionary can help you over here in one, instantly defining any term wherever you are getting stuck. Two, deconstructing any term if you really want to understand the context in which it is used. And three, it is easier to understand your document if you have a dictionary or if AI can simplify it for you. However, again, there is a trap to it. One, you cannot over rely on it. At times, AI has a good habit of hallucinating. So it can generate words with prefixes and suffixes which really do not exist. So please do not over rely on AI. Again, the context is king. What exactly it is meant? See, AI Can AI can one of my I heard this today from one of my friends. Uh, Knowledge and advice, they are poles apart. So AI can give you knowledge which is already existing with it, but when it comes to advice, when it comes to give meaning, to add meaningful insights to something, AI is useless. Therein, human intervention is must. Let's see how. So, for example, there is this doctor's note: biopsy results were positive for malignant cells. Plan to initiate chemotherapy. AI was given a prompt to rephrase this sentence in an easier language so that it can be pasted into the discharge summary as an instruction for the patient. So, what AI wrote? Good news, your test results came back positive. It ensured to use the same word positive, so technically it was correct. But was it correct? No. Right? So herein human intervention is must when it comes to communicating the medical information. So with this, we come to the end of the session. Key takeaways would be: one, be clear in all the medical communications. Two, grammar will give credibility to your document. And three, terminology is certainly power, and you should try to keep enhancing your power bank, and AI will be your co-pilot. Use it wisely. Thank you. Stay tuned for the third module. Thanks.